Hi, welcome to Political Perspectives. I'm Cynthia Dickstein, your Political Perspectives host. Our topic today is universal health care in Canada. In a recent speech referring to America's national health care system, President Clinton said that health care is one of the top 3 problems our country faces, along with economic inequality and energy dependence. According to the World Health Organization, the availability and quality of health care in the United States ranks 37th in the world, and yet our health care system is the most expensive in the world. There are 46 million Americans who have no health insurance, which contributes to the fact that among rich countries, people in the United States have the lowest life expectancy and the highest infant mortality. France's system of universal health care is considered the best in the world. Great Britain's systems seems to be in trouble. Canada's system is promoted by many in the U.S. as a possible model. However, there is intense lobbying and millions of dollars being spent yearly by insurance companies, drug companies, hospitals, and physicians' organizations to fight the implementation of any policies or legislation that might favor or lead to single-payer, universal health care in the United States. Consequently, it is very difficult for Americans to find unbiased information about other healthcare systems, information that might help us remedy our own system's healthcare crisis. With us today to provide some information about Canada's universal healthcare system are 2 Canadian citizens. I am pleased to welcome Anne Baldwin, a nurse educator who was part of the Canadian system of healthcare for 17 years. I'm also pleased to welcome Sol Littman, sociologist turned journalist, who is currently a visiting scholar at the University of Arizona. And Sol, my first question is for you.
Good.
And I want to quote you in a piece that you wrote in the guest opinion for the Daily Star recently when you said you were, quote, amazed and angered by the distortions and misrepresentations in the American media of Canada's government-funded one-payer medical system, unquote. Can you talk about some of those distortions and misrepresentations?
Well, the major distortion has been leveled at the waiting list that exists in Canada for medical care. And the American propaganda machinery or public relations machinery is sponsored by drug companies and medical societies here who are very fearful of Canada's universal single-payer scheme. And they've written numerous articles. I was responding really to someone else's article in the Daily Star. But most of the flame and fire comes from something called the Fraser Forum. I have a copy of the Fraser Forum here, and you'll notice that letting the market save Medicare. In other words, the Fraser Forum, which is a very, very conservative Canadian think tank, sponsored mostly by American oil money, which is very protective of its rights in Canada. And the Fraser Forum does very bad research. It's still fighting the theory of evolution. It's still combating the notion of global warming. And it wants to privatize a very, very good universal Canadian health scheme. And because the United States is ideologically committed to the idea of free enterprise and letting the market run everything, Americans have bought on the idea that somehow or other what we have in Canada is a terrible failure and we wouldn't want to have it here. But I think that both of us, given our experience in Canada, would say that the Canadian scheme is markedly, markedly superior to what you people suffer in the United States.
All right. Anne, earlier in conversation with you, you said, and I'd like to quote you here as well, you said in the U.S., speaking of suffering, you are over-medicated, overweight, and underserved. Is that how you would reply or answer to Americans who say that we have the best healthcare system in the world?
I should say that add to the underserved, that you are underserved by the most up-to-date medical technology and gizmos that the medical world has to offer. And the very sad thing is that there are so many people in this country who have no health insurance at all. And therefore they're not recipients of all this wonderful care that is available. We all know that there's more money to spend on research in the States. It helps us in Canada because we read the journals and we understand what the latest technologies and research shows. But the wonderful thing in Canada is that that information is available then to everybody who lives in Canada.
Do all citizens have access to health care in Canada?
Absolutely.
Every single one?
Every single one, whether you're young or you're old, whether you've had a prior condition or not, whether you have a present condition, whether you're employed or unemployed, the Canadian Health Scheme covers you all. And it's done with great efficiency compared to the American Health Scheme. It costs us about half the amount of money to administer Canada's health scheme that it costs in the United States. That's because there's no profit motive. The drug companies are under obligation to negotiate with the Canadian government in terms of what they'll charge. The amount doctors can charge is also negotiated between medical societies and the local provincial health minister, so that costs are kept down.
And who pays for this, though? Someone has to pay.
All of us.
All of us pay with our taxes.
But we pay it gladly. No, I'm very serious about that. Americans really feel that, they have no obligation to pay taxes, that somehow or other somebody's expropriating their money. But in Canada, we feel we get service for the money we pay in taxes. If you ask Canadians whether they would like to abolish the Canadian Health Scheme, 90% of Canadians would say, no, don't touch it, leave it alone.
I could add a little something to that. My mentor when I did my RN training in Canada, before I came down here to get my degree at the University of Arizona, my mentor was saying that the thing that will spoil our health care will be a two-tiered system, which is creeping in some of the provinces where people with money can go to private clinics. And not only are they taking, does that then turn into a health for profit situation, but they're also taking some of the best doctors, the best students out of the universities into that system, which then makes the system for the rest of the people not so perfect. And this is what's happened in Great Britain, exactly. And it's happened in New Zealand. And it was she who said to me, just remember that the system works magnificently when there are emergencies. The triage, yes, people have to wait for care, but the triage system is what we have, which, if your viewers know that triage means the most serious are looked after first, and the care is superb.
I'd like to add to that, if I may. We say in Canada that, yes, some aspects of our health care are rationed. In other words, we don't have all the machines, all the x-rays, all the doctors, all the hospitals that we probably need. But it's rationed on the basis of need, medical need, not on the basis of your income. You can't jump to the head of the queue simply by paying your way there. And it's true, there have been efforts made to develop a two-tier system, but I think that Canada is now turning those efforts back, because we know that, as you said, it will be the death of a very, very good system. One of the things that you're quite right is impeding things in Britain was that they started with a two-tier system. Harley Street has always been there with all the expensive medical doctors and specialists and so on. And then they added to that the universal health care. In Canada, we began with a very good healthcare system in several of the provinces, added to it, built on it, and we now have a very, very strong universal system in which is administered by each of the provinces. 10 provinces and 3 territories. But the federal government very wisely, very cleverly inserted itself by saying, we'll pay half your costs. And that, as long as you meet our standards, and these will be universal standards, you can go from one province to another and you'll still have the same medical care.
I believe we have a map of Canada to show Americans just how large the country is, and where both of you come from, because Sol, you're from Toronto on the East Coast,
That's right.
and Anne, you're from British Columbia on the West Coast.
And we had the same medical care.
And you had the same medical care. I think Americans don't even know, many Americans, don't even know whether you can choose your own physicians.
Absolutely. Go ahead,
Yes,
tell them about it.
Yes, of course. Because there's no health insurance with a stable of doctors, if you will, that work for that medical insurance company and don't work for another one, we don't, which is what happens in the States, we don't have that sort of restriction. Our family or primary care, as you call it here in the States, we're more inclined to call it a family physician, will refer us to the specialists.
And
You choose any doctor that suits your fancy.
and it sounds to me as if the system is far easier to navigate than ours here in the States.
There is a problem in certain areas of the country where there are very long waiting times for certain, not just elective things, but surgeries that need to be done, but they're not life-threatening. And one of the things that Canada is now looking into, and with the promise of the present political party that's in power, is that they would explore with the doctors what a reasonable wait time would be for each particular surgery or treatment that had to be done. I had a personal terrible time 2 years ago and ended up with my knee in a cast, and I was on crutches. And when I phoned to get an appointment with an orthopedic surgeon in a small town, very popular with elderly people as a retirement place, I was told that I could see the specialist in 8 months.
So that means that some of the information about the negative aspects of Canada's healthcare system that Americans is getting are true.
In certain places. I think in northern Canada, we've been blessed with many, many good doctors coming from South Africa when there was the worry of internal strife in South Africa. Many of them emigrated to Canada, and they have provided care because they can be licensed to practice if they promise that they'll go way up into the Tules rather than stay in the cities.
You have to realize that Canada is a large country with a relatively small population. We have a population of about 40 million. You have more uninsured people in the United States than we have population. And because we're a sparsely settled country, living in a ribbon about 100 miles north of the American border, that's where 90% of the population goes. There's unquestionably problems in Indian country, in the Yukon and elsewhere, where it's hard to get doctors to stay for very long. And in small towns where you don't have full services. On the other hand, given a city like Toronto, we never had any problems with waiting lists. And the average across Canada for an elective surgery is about 4 weeks. Yes, this is the latest statistics. I have it here. You want to?
No, I'm just surprised. I'm just surprised.
Well, because it's been a subject of worry for not only the people who are on waiting lists, but it's also been a subject of worry for the government. Because boy, you know, you can get voted out of office pretty quickly if there's too long a waiting list. So every effort has been made by the Canadian government to reduce that waiting list. Now, like any other human organization, there are things that fall by the wayside or fall into the cracks, and people are not perfect, neither are the organizations which they create. And certainly there are problems in the Canadian health scheme but none of them compare to the terrible problems that exist here in the United States.
I think Americans' opposition or resistance to health care in Canada, and I won't even use the word socialized medicine because that's such a charged, highly emotionally charged word.
I'm not afraid of it. You can
so
use it in my presence.
But a lot of the resistance comes from potential cost, as in which we alluded to earlier, higher taxes, and the questions of quality of care, and the fact that there's a belief that the care, without competition and without the promise of higher profits, that perhaps the quality of care suffers. And how would you address those concerns?
I'd like to speak to that. I think that the best way I know of to describe for American people is that you have two people entering the hospital, and I'm the nurse who's going to admit them. And if a Bill Gates comes in one door and followed by a street person from downtown Vancouver, I would give them both gowns, shampoo, soap, towels, and show them where the showers are. And once they take off their clothes and put on those very unattractive hospital gowns that always seem to be losing a tab at the back, and everybody's very self-conscious, you can't tell the difference. When they've both had shampoos, they've both had showers, and I think that is the wonderful thing about our system that Americans don't realize. They're both going to get quality care.
May I add to that, Anne?
Mm-hmm.
The quality of care in Canada is top rate. No other country in the world offers better care or has better trained doctors or better hospitals or better equipment. It's a myth to say that somehow or other the quality of service is lesser in Canada than it is in the United States or any other country. Our doctors come here, about 300 a year, and take up positions in American hospitals. Some of your doctors, not nearly as many, about 20 a year, come and settle in Canada. The two medical educational systems are intertwined. American doctors sit on Canadian boards and Canadian doctors sit on American boards. So there really is no difference in terms of the quality of care, but the simplicity with which you get it. You walk in, they already have your OHIP number, your Ontario Hospital Insurance process number, and there's no fuss, no bother. The doctor maintains a computer record. He sends it in to the provincial healthcare department. He gets paid immediately the full cost, the full share of a predetermined cost. And in this way, our medical costs, just for administration, are 1/2 of what you have in the United States.
Sure. Let me ask you about the brain drain, because I have a statistic here from the Canadian Medical Association Journal that says currently 1 in 9 doctors trained in Canada are now in the United States, and that there are not roughly, 8,162 Canadian trained MDs in America.
That's right.
But many of them have said that they're a bit unhappy and would be willing to go back to Canada with the right incentives. But that is another thing that Americans know about and say, well, why are these physicians leaving Canada if it's so wonderful? Are you your best and brightest leaving for higher profits in our medical system, and isn't that detrimental to the Canadian healthcare system?
May I answer that
Of
first?
course.
I think it very often it is a chance to do research in a large hospital in a field that Canadian doctor is particularly interested, and or they get paid a great deal more than they do in Canada. And oftentimes the number of doctors that are available in a clinic to spell each other off so that the doctors can enjoy weekends off with their families. Those are 3 of the things that I can think of off the bat that would draw very bright and ambitious and I hate to say greedy, but there are some greedy people in Canada, and they would like a better life in the dollars and cents way, perhaps.
I have a slightly different version of that, which is quite interesting. You know the slogan, if you make it in New York, you can make it anywhere? Canadians for all of my life have felt that somehow if you make it in the United States, you really made it. Why did I go to the University of Wisconsin for graduate work in sociology when we had a very good sociology department at the University of Toronto? Simply because in the academic field, the Canadian academic field, you need an American higher degree to make sure that you really are one of the best. Not that we don't provide the same scholarship. And similarly, many young Canadian doctors feel that if they can make it in Texas or make it in California, then they will have validated themselves as medical practitioners. Now, some of them go down because salaries are higher. But this is, again, a bit of a trap, because while their salaries are at least 1/3 to 1/2 higher than they might earn in Canada, they earn $400,000 here on the average. In Canada, they earn between $250 and $300. Okay.
I'll take your word for it.
Well, I have the statistics here in my file.
Yeah.
But in Canada, they don't pay the same fees for liability insurance. I know doctors here who are not practicing anymore because they can't afford the $100,000 liability fee insurance that they need in order to continue practicing. In Canada, that doesn't happen. There are many other things in which the matter of payment evens out. There is, if we have the time, there's another very important issue. I interviewed 12 young Canadian doctors who had returned for a reunion at the University of Toronto. All of them were practicing in Texas and California hospitals, and a couple in Alabama. And I asked them, how do you find medical practice in the United States? And they said, oh, excellent. Great facilities, great lab, et cetera, et cetera. I said, well, is it any different than the practice you had in Canada? They said, oh yeah, a lot different. I said, well, in what way? So they conferred, and after a while, one of them came back as their spokesman and said, well, in Canada, we didn't see any real pathology. In the United States, we see a lot of it. Now, please explain to our audience what real pathology means. Real sickness, real illness. Canadians go to a doctor before they become really ill.
Are you saying that you have, because of the access, you have the ability to focus more on preventive medicine
That's
and
right.
staying
Exactly.
healthy? And that our system here is, I know we're quite good about trauma,
Yes.
frankly, because of the wars that we fought. We've learned a lot. But okay, that leads me, because we have only a few minutes left, believe it or not.
Really?
I have two more questions I want to ask you. If it were elective, would you choose to have surgery here or in Canada, Anne?
That is a very tough question. I know I would have the same quality of care in both, and I think it would just be a matter of where I was in Canada and what the wait list was versus being in. I'm fortunate enough to have insurance in Canada and in the United States, so I can choose. And I think that's, for me, it's hard to answer. Wherever I happen to be is where I would have the surgery.
Okay. Sol?
I've had surgery in both countries. And about 30 years ago, I had my gallbladder taken out at Mount Sinai Hospital in Toronto. And there, they don't throw you out right away. They keep you in the hospital for 3 or 4 days to make sure that you've really fully recovered. And when I left, they handed me my bill, $5.50 for the use of the television set. Now, I won't discuss my surgery here in Tucson or what it cost me here.
Okay. We could have spent the whole half hour on my next question. We just have another minute to devote to this. But clearly there's a difference in philosophy here, that Canadians believe that a government has an obligation to provide its citizens with health care. Other countries believe that. In America, we believe it's market-driven, has much better results. And apparently we don't believe that. Maybe we're more social Darwinists here. We maybe believe that you earn it by being a productive member of society. And I wanted you to just address this a bit. I mean, it really comes down to one's philosophy, doesn't it?
Yes.
Yes, it does.
Yes, yes.
It certainly
And it's
does.
very interesting that Jonathan Cohen, who's just written a book called Sick, The Untold Story of American Healthcare, suggests that already California and Massachusetts are investigating social medicine for every person that lives in those two states.
Mm-hmm.
Americans want to provide good health care, but every effort to bolster the system is really a Band-Aid that's going to come off. The real answer is universal, single-payer system similar to the one we have in Canada, and any effort to do otherwise is simply going to end up being more expensive, less productive, and less efficient than what you already have.
Mm-hmm. So what you're saying is that it's not a question of philosophy, it's really a question of practicality and what works and what doesn't work.
It will eventually be one of practicality. I think that as the Americans suffer, it's evident now there are more and more newspaper articles about the insufficiency of the American health care. And eventually they will do the logical thing, namely try and develop a more efficient, more competent system, mm-hmm. regardless of ideology.
Okay. Well, it's interesting that there is one segment of America's society right now that is pushing for single-payer health care, mm-hmm. and it's big business and little business, because they are being, I mean, they just can't afford the health care costs for employees. So it's not where you would expect this to happen. But
that's right.
I think that the American people have to get into prevention. And when I was a parish nurse, that was here in Tucson. That was what I tried to promote.
I'm with you there. And I want to thank you. I want to tell you we're out of time, believe it or not. And I want to thank you, Ann Baldwin and Sol Littman. It was wonderful to speak with you today.
Thank you. And my pleasure to be here.
And I'd like to leave everyone with our customary quote, this time by Martin Luther King, who said, "Of all the forms of inequality, injustice in healthcare is the most shocking and most inhumane." Thanks.
Amen.
Amen. I'll second the motion.
Okay. Really, thank you so much.
Thank you, Cynthia.
Isn't it amazing how quickly